Hello, hello, everyone. Thank you so much for joining us for today's webinar. I'm the producer for Texas Fertility Center, and I'm so happy to introduce you guys to Dr. Susan Hudson from Texas Fertility Center, New Braunfels, as well as Dr. Erica Munch from Texas Fertility Center, San Antonio. They're going to be covering everything about your first fertility evaluation today. There is a questions tab on the side for you to submit questions, and they're kind of going to go over a few of those little details. And it should be a great webinar. So thank you guys so much. And here are your doctors.
Hello, everybody. I'm Dr. Susan Hudson. I'm one of the physicians here at Texas Fertility Center. I am primarily in the New Braunfels and Corpus Christi offices. And I want to welcome all of you and look forward to hearing your questions and getting to share a little information about your first new patient appointment.
And hi, I'm Dr. Erica Munch. I'm from San Antonio in our San Antonio office for Texas Fertility Center. Very excited that you're making time to join us tonight. I know that fertility is sometimes a difficult journey, at any time, and it's certainly difficult during a pandemic. So we're both here to answer your questions today, talk with you about how to get the fertility evaluation going, and really kind of go over those first steps about what to expect at your visit so that you come prepared and, well rested and calm and excited about moving forward. So thanks for joining us tonight.
We're going to give you a little bit of information about the webinar. This is our second webinar as a part of our ongoing webinar series. We'll be hosting these every couple of weeks, and each one will be focused on a different fertility-related topic. The next one will be on IVF versus tubal reversal, and will be happening on August 27th at 6:30 p.m. We'll be sending another email out tomorrow with the registration link in case anyone would like to sign up, along with a quick survey form.
All right, and before we get started, just to give you guys an update on how this is going to work, Susan and I will be talking a little bit about that first fertility evaluation. You guys are welcome to answer or ask questions at any time during the podcast. Just use the chat feature on the side of your screen. We're going to be stopping in the middle and at the end of the presentation to address a couple of those questions. We'll try to get as many questions as we can fit in, but we may not be able to get through all of them. And also keep in mind that we can't answer any questions that reference personal situations. So the more generalized you can make your question, the better it is for helping us answer it for the entire podcast audience the webinar audience today, and also be able to make sure that we get your question answered. So please, we encourage those questions. It gives us something to talk about, and we love hearing from you.
All right, so just to kind of get started, what to expect when you're wanting to make that first appointment. So first of all, there's a number of ways to contact us to make that first appointment. Traditionally, you can pick up the phone. Some people like doing that. Some people would like to do it a little bit more distanced. And for those people, you can go to our website and actually put in an inquiry that will let us know that you're interested in a new patient appointment. And then we will contact you and figure out the best location for you, since we have locations that are all the way from Round Rock, literally down to Corpus Christi nowadays, and really get something that will work best for you and your personal situation.
So when you call to make your appointment or you fill out our online contact form, one of our front office staff is going to reach out to you, and they'll get a little bit of information to get us going so that way we can help you schedule your appointment. Of course, they're going to get your name and email address and demographic information about your partner, how long you've been trying. They're also going to start with the benefits verification process. Now, most people don't realize that most all insurances will cover some degree of fertility testing, right? And that's important. So just like any other doctor's office visit, they're going to ask you for insurance information, let you know if we're participating with your insurance plan, and go through and verify your benefits before your appointment. So that way, when your appointment time comes, you have kind of a sense of what your employer is covering as far as fertility coverage, and that you know what to expect at that visit. So they'll book you for an appointment with one of our physicians. And then at that time, you'll get some information sent to you, usually over email, as far as like the new patient paperwork and things to fill out. That helps it make it easier on our end when you come in for your appointment, so that we can really focus on, the important part, which is your history and talking about our next steps. And we get all that paperwork and stuff done out of the way.
Absolutely. So after you make the appointment, you got to go to the appointment. And, there's a couple of different ways nowadays that we can accomplish that. So traditionally, you can come into any of our offices and we're happy to see you. But we also are very cognizant that in light of a global pandemic, that may not be the best idea for everybody. And fortunately, because of some of the things our governor has done, a lot of our patients nowadays have coverage through their insurance to do telemedicine visits. So we do telemedicine visits through a number of different kind of service providers. Some of us use Doximity, some of us use GoToMeeting, amongst some others. But we're able to then be able to sit and talk to you. You can be in the comfort of your own home, which I think is fantastic. Or sometimes people are, at work in a private office. It's great because sometimes partners are in different places, sometimes even different states, and they can independently call in and participate in that new patient appointment. So we have a variety of ways that can happen. But when you come in for your appointment, essentially you get to spend about 30 minutes with one of us. And we are going to start and talk about your fertility and ask all the questions that we need to help figure out what's going to be the best path for you initially to get your testing started.
Right. That's a good point, Susan. I think it's really important to emphasize that we do encourage partners to be part of that first visit if they can, right? We're treating a couple. Of course, usually the appointment is going to be made under the female that's trying to carry the pregnancy. But like I said, fertility takes all shapes and sizes and forms. And so we're happy to engage everybody in that family building process. And so if your partner wants to attend that appointment, they're encouraged to do so. Of course, during this, kind of crazy time with COVID-19, right now, having visitors up in the office, we're trying to limit the amount of exposure that our current patients have. And so the best way to facilitate making sure both partners are up here is oftentimes through the telemedicine as of right now. But of course, if this webinar gets recorded and things get outdated in a few months, things may change. But please know that we're keeping your health and safety at utmost importance. And that means, changes that we roll with as the situation changes. So with that being said, at your first appointment, we do what telemedicine or in-person independent, we're going to do the same thing we always do, which is usually bring you back to our office and we're going to start talking, right? We're not going to bring you into the exam room, put your feet up in stirrups and say, okay, we're ready to figure out what's wrong, right? This is our chance to really talk with you and kind of figure out what is bringing you here today. What are the things you've already tried? What are the things that you're worried about? What are the things that you feel like your other doctors have looked over? What are the things that keep you up at night worrying that this is never going to happen for you, right? So getting a pretty thorough history, figuring out what's going on, talking about kind of, how adolescence was for you and your periods and how they may have changed, talking about what you guys have already tried. And of course, like all doctor visits, going through your past medical history, surgeries you've had before. But a lot of it is spent, kind of talking and figuring out both history of both partners rather, to figure out kind of what is bringing you here. So that way it guides us to know what are the appropriate next steps to take.
Absolutely. We go through kind of some basic physiology, teaching you a little bit about reproduction. What does it take to get pregnant? Because surprisingly, a lot of people don't know some of those details, the basics, but not the little intricate details. And really kind of setting things up because a lot of people come in from different situations. Sometimes we have people who are older who are wanting to start a family versus people who are younger who are wanting to start a family. Sometimes we have same-sex couples or women who independently want to get pregnant without a partner. There are lots of different scenarios, and we really do, like Dr. Munch mentioned, we really do try to personalize all of this. Now, when a lot of what these conversations are leading to are helping us figure out what are the tests that we're going to order that are going to help lead us to figuring out what exactly we need to do to help you get pregnant. Talking a little bit about the tests that you're going to look at, we're generally going to do some testing on how your ovaries are functioning, or what we call ovarian reserve testing. Usually a combination of an ultrasound as well as some blood work to see how the brain and ovaries are talking to each other. A lot of times we're going to check your thyroid function, which is your major metabolism gland. We're going to do a test to make sure your fallopian tubes are open and healthy appearing. We're generally going to do a pelvic ultrasound to kind of check things out. And we're going to talk about that in a little bit more detail later. We're going to, if there's a male partner, we're going to want to get a semen analysis and kind of go over what's involved in that, some different types of semen analyses that are available. And, you know, depending on that history that you've given us, there may be additional things we need to look at. You know, one thing that is really important coming into that new patient appointment is making sure that your health is in the best condition that it can be in. So if you have a chronic medical condition, you know, talking to that doctor, whoever you've been working with, whether you have rheumatoid arthritis or ulcerative colitis, or, you know, just to name a couple of different conditions, making sure those things are in as good of check as they possibly can will help you on your fertility journey.
Absolutely. And we do get questions about that too. You know, certainly as we're going through history, I find that a lot of patients will ask, well, what can I be doing? What should I be doing? You know, is there anything that I can do, right? Because infertility is already, you know, it's already a condition where, you know, just like diabetes or cancer or chronic medical conditions, this is a medical condition, right? I mean, there's something going on, and it's likely not anything that you did. Now, with that being said, there's things that people want to know, you know, how can I best optimize fertility, right? And just like Dr. Hudson said, you know, so we talk with them about their diet and what they're eating, and making sure that they're getting a well-balanced diet or taking a prenatal vitamin, talking about their weight and how weight can influence people's fertility. Sometimes we talk about things that they're doing as far as exercise. We talk a lot about, get a lot of questions about supplements and what supplements people should be taking or shouldn't be taking, or I saw this thing on Amazon and it looked really awesome, and what do you think about that? And so we spend a fair amount of time not only talking about kind of the testing for infertility and how we're going to move forward, but also ways of optimizing your own natural fertility.
Including not smoking. No
Yes.
nicotine use.
that is important. So let me talk a little bit about the ultrasounds, because I know that's another thing that oftentimes when the front office staff are calling you to let you know kind of about your upcoming new patient appointment, they may suggest that the doctor may want to do a pelvic sonogram, right? And a lot of people just kind of get apprehensive thinking about that, right? So let's talk a little bit about what it is. So a pelvic ultrasound is an internal imaging study that we do here in the office that can look directly at the organs, right? We're not cardiologists. I can't just put a stethoscope on the, you know, on the uterus and figure out what's going on. And I can't see your ovaries just by looking at you or saying you must have great ovarian reserve because you're 30, or that your egg counts are really low because you're 45. And we don't know that, right? We can't tell just by looking at somebody what's going on. So the ultrasound is like our eyes essentially into what's going on internally. So when we think about doing a pelvic ultrasound, it's because we need to know kind of where the anatomy is at and what might be going on that might be impeding a pregnancy. So we do our own ultrasounds here in the office. We don't have any sonographers that perform new patient ultrasounds, because it's really important to have a physician be able to look at those structures and give you an assessment in real time and say, hey, you know what, I see this fibroid over here. And because we're physicians, we're able to give you those diagnoses. A lot of times you get pelvic ultrasounds done by the sonographers who are wonderful and well-trained, but they're not legally able to give you the results until a physician has signed off on them, right? But here in the office, we're looking at those ultrasounds and we're taking those pictures and talking with you during the ultrasound saying, hey, you know, it looks like you have this cyst over here that might be suspicious for endometriosis, or you've got this fibroid over here that's really pushing into this space and causing an issue with implantation potentially. So the pelvic ultrasound is done here in the office. It takes about 5 or 10 minutes. It is painless. You'll feel some pressure when we're doing the ultrasound, but generally it gives us a really good idea of what's going on internally and often helps us formulate what our next steps are. And I think for a lot of patients, it gives them some reassurance too when they leave and they say, hey, you know what? I'm not worried about that big bad something that I thought was inside. That pain I was having is not some big cyst on my ovary. She saw my ovaries and everything looked good. So that's what the pelvic ultrasound is for. It's not required of everybody, but I think for a lot of patients who have never had that kind of imaging study done before, it really helps us figure out what might be the underlying cause of the infertility issues and helps us decide what the best way to move forward is.
So do you want to go to some of our questions? Looks like we've got a few popping up here now.
That sounds good. I did see a question I wanted to address specifically kind of about preparing for the new patient appointment and what to do. Some people say, well, do I need to do anything beforehand, right? They say, well, do I need to do A, B, and C before you'll even see me, right? Because I know some clinics kind of work like that. But at TFC in general, we want to take you wherever you are in your journey and wherever your previous doctor has taken you in that journey. So some people have had no testing whatsoever. You may or may not, based on your insurance, need a primary care doctor to refer you here, but that's very patient specific. So you have to check with your own insurance company to see if a referral is required. Some patients need those from their primary care doctor, some don't. As far as the type of medical workup that you need beforehand, it can be nothing, something, or all the things. It doesn't really matter because whatever needs to be done, we're going to get taken care of. So some people come in because they know that they're having an issue. Maybe they don't even have an OB-GYN, right? Maybe they just know that there's something wrong, or maybe they have a primary care doctor who's great with things like blood pressure and diabetes, but doesn't really have the arsenal that's needed to complete the fertility evaluation. And so they come to us not having had any kind of blood work done or x-ray tests or semen analyses, and that's fine. We're going to take care of it. Some people have had OB-GYNs do part of that and do, this here and that there, and then they come and we complete the rest. And some people have had all the things and they're kind of ready to go. They just need somebody to explain what all these tests mean. So there's nothing specific that you need to do to see us from a medical standpoint. We're happy to jump in with you on that journey and take it as far as as we need to get the answers. So hopefully that answers that question. A couple other questions as well.
Yeah. There's one question asking if they've had a HSG and a transvaginal ultrasound with an OB-GYN already, do I have to repeat those? So just like Dr. Munch was saying, we don't want to reinvent the wheel. Generally, if the HSG has been done within the last few years, most of us will accept that. I have to say a transvaginal ultrasound is something that I generally do myself, and I think most of the other physicians at Texas Fertility Center do the same, because there really are things that we are specifically looking at, like your antral follicle count, how many little follicles are in your ovaries, looking for uterine septums, different things like this that generally when you're getting just a transvaginal ultrasound, those things are not necessarily noted. And so that's something that I do think is pretty important, and that usually is repeated. But, HSGs, a lot of your blood work, if you've already had it done, those types of things, we're not going to repeat something unless there's a valid reason for it.
Right. And certainly if your OB-GYN has already done those tests, oftentimes they may make a copy for you to bring with you to the appointment, or you can have your OB-GYN's office send it to us directly. So that way we have that available to us at the time that we're having our new patient appointment with you. So we can say, hey, it looks like these tests here show this, and we don't need to repeat that. This test here showed that this part was inconclusive, and so let's go down that direction now and explore that a little bit further. So certainly having whatever fertility records that you have from your OB-GYN is important. We usually don't need things like years worth of pap smear results or things like that. We want to know that you're in generally good health, but whether or not you had a leap done 20 years ago is probably not as important in the fertility evaluation. And especially nowadays when, places are charging you for records and you don't have to have hundreds and hundreds of pages sent. And if there's any question, you just tell us, hey, I think I had that blood work done already. Or, oh yeah, I remember that x-ray test. That's fine. We will, when we're talking with you in that new patient evaluation, figuring out what steps to go forward with, we'll request the records from our office ourselves. So that way we're not getting 300 pages back. We're getting the one page that tells us the information that we need. It saves you a lot of hassle trying to gather a lot of things that you're not quite sure we're going to need anyway. And it saves us, it helps us save you the trouble of spending a lot of time chasing, down a lot of paths that you don't otherwise need to worry about. You got a lot of things going on.
We have a couple of questions about partners. One of them is, with the pandemic going on, can our partner attend visits with us? Currently at Texas Fertility Center, we have a limited type of visits that we encourage partners to come to. So for OB visits, those types of things, for the initial consultations and follow-ups, because we really are trying to limit your exposure as well as our exposure. If you have an in-person appointment, we are asking that you come alone. However, your partner is more than welcome to FaceTime, call in. We want them to be a part of the process. And, this might be a situation, if you really want your partner to be there, is potentially using telemedicine so the two of you can be together in the same place and communicating over the internet. And then also about, does your partner have to have insurance coverage? So the way insurance coverage works in Texas generally is that about 80+% of people who have insurance through their employer are going to have fertility testing coverage. Now, when it comes to the guy's part, he's going to need to do a semen analysis and usually maybe a little bit of blood work. So if he has coverage, that's great. But even if it's out-of-pocket expense, it's a pretty small percentage of the big fertility evaluation. Okay. When it comes to actual treatment and insurance coverage, really the female is the one that it's really important to have coverage if that's available. But also note that in Texas, only about 20 to 25% of people have some fertility coverage for treatment. And that can vary from, unlimited, which is very rare, to, maybe a $5,000 or $15,000 max, or it may only cover IUIs, or it may only cover IVF. There's lots of variances. It's all determined by what your employer decides they want to provide. So sometimes people are like, what type of insurance do I need? And it really doesn't matter if you have United, Blue Cross, Cigna, Aetna, name your insurance coverage. It really has to do with the company that you happen to work for. So that's kind of what is really the main concern there.
Right. And if you don't have insurance coverage through your employer, one thing that most fertility clinics, Resolve, which is the National Infertility Awareness Association, they will all recommend, talking with your HR reps at your particular places of employment and say, hey, you know what, this is important to us. This is important to other employees that work here. Is there a way that next time they're coming up with their benefit, annual enrollment stuff, like they can allow for employees to choose plans that do have some degree of fertility coverage. So it's really important to help be an advocate, not only for yourselves, but kind of the larger population of people that are using services like this to become pregnant. One other question, and I think then we'll go on to talking about kind of the what happens after that first visit. There are some questions that are geared towards, what needs to happen from a chronic health or management standpoint before coming? Do you need to, get to be an ideal weight? Do you need to have your diabetes under perfect control? Do you need to make sure that your blood pressure is less than 140/90, right? Are there certain things that you will need before we can go through fertility treatment? I would say oftentimes we do want you to have those conditions optimized before we get started on fertility treatment, but it certainly doesn't preclude us from being able to have that first evaluation, because oftentimes not only might we identify something else in the evaluation that we need to work on in the interim, but it gives us a chance and gives you a chance to have this kind of, three-way relationship with your physician that's managing those other conditions, right? So if you're trying to lose weight, having our recommendations on board for what a good goal weight would be, right? If you have diabetes, talking with your physician saying, hey, I want to get pregnant, there are certain criteria that we have that we want to make sure that the risk of birth defects is minimized and the chances of a successful pregnancy is optimized at certain goals of blood sugar, certain blood pressure levels, right? And that having that new patient appointment to kind of lay the foundation and say, this is where we want to be, gives us all a better chance, gives your other doctors a good chance to get you into a position where fertility treatment is going to be best optimized and optimal. So no, you don't have to be there by the time we make that appointment, but let us help kind of get that in process so that way we can get you there by the time that we start.
Absolutely. Absolutely. So once you've had your new patient appointment and you've gone through your testing, and I think we'll probably eventually have a webinar about all the little intricacies of all the different types of tests, you're going to have your follow-up visit. And at your follow-up visit, we're going to go over the results of all those tests. And I always explain it as we're really putting a puzzle together. There are lots of pieces to the puzzle. And we tend not to release like one little piece of information at a time because it's really hard to tell you what this means without having the big picture. So at that follow-up visit, we're putting all the pieces of the puzzle together, really creating your own picture and figuring out what is the problem, and then figuring out what's going to be that best treatment plan. Now, what are some of the most common fertility problems out there? So commonly we see people who have what we call ovulatory disorders. So they're not ovulating on a regular basis. That most usually is related to something called polycystic ovarian syndrome. Oftentimes we see situations where there's a sperm issue. Where there may be a quantity issue, there aren't enough sperm, or maybe the sperm aren't functioning as well as we would like them to give us a good chance of pregnancy. There's tubal factor. So the fallopian tubes, the connections where egg and sperm actually get together, sometimes those can be blocked. Sometimes they're blocked because somebody's made that choice. So somebody's had a tubal ligation. We know we need to bypass those tubes. But sometimes people have had infections, or that they just have a condition where their fallopian tubes are not healthy enough to help them achieve pregnancy.
It's a good way of putting it, Susan. I like how you talked about a different puzzle. And I mentioned that at our first patient appointment. I say, we're trying to figure out what your body is telling us, right? And these are the tests that we use to help figure that puzzle out, right? Because some people, I think, for better or worse, might expect at that first appointment that we're just going to write off a prescription for Clomid and send you on your way, right? And that would be the easy thing to do, but that would oftentimes not be the right thing to do, because there are a lot of different reasons that people can't conceive. And it's not just necessarily because they're missing a Clomid prescription, right? There's other factors. Clomid's not going to fix the tubes. Clomid is not going to make your uterine fibroid go away. Clomid is not going to make sperm counts for him to go up if it's the female that's taking the Clomid. So there's a lot of things that we want to look at, so that way we identify the best path moving forward and do it in an efficient way, right? You don't want to be spinning your wheels for 3 or 6 months and then say, oh, now we've actually realized that the tubes were blocked all the time, and kind of move down that path. You'd be very frustrated. So would we. So we want to figure out where this puzzle, how the puzzle is coming together, and figure out what is the best step forward. And I think that's also important, because I think a lot of people worry about making that first appointment because, one, they're just not in a mode to even get ready to go to the fertility doctor. Nobody wants to come to see us. We get that, right? I mean, this is not a place where people want to be discussing their most intimate family building plans. And with that being said, they definitely don't want to come in and feel like they're just getting handed prescriptions and going down this path, and they're like, whoa, wait a minute, like, this is too much for me right now. Like, let's take a step at a time, right? And that's what we're doing here, is we're taking a step-by-step approach, being very methodical, coming up with our treatment or our diagnosis and figuring out what's going on, and then coming up at that follow-up visit, like Dr. Hudson said, to put together a very personalized treatment plan, right? Because we got to figure out what's going on with you and what we need, and then taking it forward and saying, here are the ways that we can achieve that. And there's usually not just one way to skin a cat, right? There's a lot of different ways to achieve fertility, and we have a lot of different tools in our box to use. And sometimes we reach for this tool first, and sometimes we have a reason to reach for this other tool, and sometimes we know that you've already had 3 or 4 tools already applied and it hasn't worked, and so we have to go in this different direction. But I think it's important to know that we're not rushing into anything. We're getting you expediently to move through this process so we can figure out within essentially a menstrual cycle what's going on, so we can get you on that path. But it's not going to be something that you're like forced into, or all of a sudden find yourself, in the room ready for an insemination, and you're like, wait a minute, that was not part of this plan. So so do know that second part of the evaluation and coming up with a treatment plan is kind of a continuation of that first visit, but really important to help us kind of take those steps that we need to get you to where you want to be.
Absolutely. Absolutely. And I thought it was real important. One thing you mentioned is that it generally takes us one menstrual cycle. So people are like, how long is this going to take? Is it going to take me 6 months to figure this out? Realistically, most of the time within 3 to 6 weeks, we have a plan of what we need to do to get you moving forward in your fertility journey. So we know that you wanted to be pregnant yesterday. And so we keep that in mind, and we will kind of help keep you moving forward as comfortably as you are. Some people are ready to move forward in a much quicker fashion, and some people need to take a little bit smaller steps. But what we want to do is the right thing for you. There is not a cookbook recipe of everybody gets treated the same way. I think that's actually one of the most beautiful things about the specialty that we're in, is that every couple comes to us with not only their own physical reason for why they're having issues to get pregnant, but we put that together with your very personal things that make you who you are, whether it's your religious background or ethical background or whatever it is. We want to put those things all together for you to figure out what's going to be the best treatment strategy for your personal situation, which may not be the same thing as what your sister or best friend or neighbor down the street did. And so that's something important to know, is that you're not treated like a number. You are truly treated as a true individual.
Right. No, that makes sense. And there's, everybody's coming to the table, as Dr. Hudson said, with, a different situation. And there are some people that have the flexibility of time on their side, and they can spend more time trying less intensive things before they move to more intensive things. Some people may work for a company that will give them all the money in the world that they ever wanted to spend on fertility treatment. And there's many people that don't have all the time in the world, or don't have all the resources, personal, financial, emotional. I mean, there's a limit to what anybody can do, right? And our goal, and part of the personalized aspect of medicine in general, is to figure out what is going to be the best situation for you and your family, right? And for some people, it's doing plan A, and for some people, it's doing plan B or plan C. And we don't have to go A to B to C. We have compelling reasons why we do this first or this next in your particular situation. And once we come up with that, right, because you're doctors, right, I'm not particularly focused on whether or not your insurance is going to pay for something if I think it is truly the best, most important thing to do, right? And so your doctors are going to spend a fair amount of time figuring out medically what makes the most sense. And of course, there are other factors that are coming into your decision making as far as what is going to be the next best step for you, right? And so after your appointment with us, essentially to go over kind of all the medical things that are going in, you're also going to have staff members from our front office staff and our billing team to be able to look at your insurance coverage, if you have insurance coverage for fertility, and say, hey, you know what, you have X amount of defined benefit, right? And some people will want to use that benefit for the very best thing that's out there, and some people want to take more of a stepwise approach, or maybe these types of fertility treatments are covered, but these are not, right? And certainly we can help kind of guide and say, well, these are the chances of pregnancy with each one of these, aspects moving forward. But oftentimes, we know that there's going to be other contributing factors besides just what we see on paper as far as helping make that decision. So there are other staff members here at TFC that help you with that process. You don't have to call the insurance company blind and say, I don't know what any of this is covered. We give you, they're going to give you these are the CPT codes that we use. These are the infertility diagnosis codes that you need to ask about, and they'll help you through that process. And I think that's important because, again, this is already, a very overwhelming process to take just at heart of not being able to have the family that you want at the time you want it, but then to think about all these other factors and deductibles and how things, interplay. Is that surgery going to get covered? What is my company going to do if I don't get pregnant in 3 months? Do they stop paying for things? And so they'll be able to help you through that process and figure those financial aspects out, as well as on our side as far as the medical things.
I always say that fertility is a team sport, and we're all part of the team.
Very much so. Very much so.
Yeah.
And one question that came up, and I think it leads into a good segue as far as, other things that we might identify during the fertility evaluation that might be beyond the scope of TFC when it comes to treating other factors, right? So one thing in general is that as reproductive endocrinologists, remember, we are OB-GYNs by training, but we did specialized training to take care of women in their approach to infertility. We know many things about male infertility as far as how we treat it and what the reason for those male infertility things are, but we are not urologists, right? We didn't specialize in taking care of the male reproductive system. So when we do order, and we do order these all the time, our semen analyses and blood work for the guys to figure out if there are low sperm counts, if the brain's not sending the right signals to the testicle, or maybe the testicles aren't picking up that signal and doing what they're supposed to. If we do find that there's an issue, sometimes we'll recommend and facilitate getting an evaluation by a urologist, right? And there are a couple of different fertility trained urology specialists, just like there are fertility trained OB-GYNs, which is us. We are REIs, but there are fertility trained urologists that specialize in male reproduction, right? And they're the ones that usually will kind of delve more into like the medications that would be used to help improve sperm counts, for instance. Or if we see that there's a low sperm count, sometimes medicines can be used on the guy's side to help improve those sperm numbers. Sometimes they might need more, stronger medicines like injections. Sometimes they might need a surgery, right? Because there might be something structurally that's going on, a blockage or a swollen blood vessel called a varicocele that might be causing those sperm numbers to be low or the motility not to be moving very well. And a urologist would be this surgical subspecialist that would help take care of those issues. And that's somebody that we work with on a near daily, weekly basis, just because it's so prevalent, right? Infertility can be a couple's issue together. And so we want to make sure that both individuals are getting the care and attention that they need. And so even if I'm not doing the surgery on the testicles, for instance, there are many well-trained people out there that can do that. And we're very fortunate in our South and Central Texas region that we've got good access to those specialists to help coordinate care.
Absolutely. Absolutely. One very interesting question. Somebody asked if somebody's done prior treatments, whether it being IUI or IVF, are those reports reviewed? And I would say absolutely. I always say that your fertility journey is not only therapeutic if you've been through treatments, but it's also diagnostic. There's some things that we don't know until we see how you've gone through a cycle. And so if you have been through treatments before, definitely try to get those records. If you've been through IVF or in vitro fertilization before, getting as much of the detailed records, especially embryology reports, your stimulation sheets, those are kind of the bread and butter of what we use to help kind of build on that knowledge base so that we get an even better result with your next treatment.
Right. So kind of summarizing, we spend the first appointment gathering information from your history, what you're telling us, gathering information from the reports that you might be bringing us, any kind of diagnostic testing that you've had by other doctors before, any kind of records that you've had from other OB-GYNs or specifically other REIs, sometimes even in different states, helping us know what has already been done. And then, of course, our part of the evaluation beyond that is learning more about what your body's trying to tell us. So between you and your records and your body, we're going to figure out what's going on and then use that information to figure out, is this an ovulation issue? Is this a tubal blockage or swelling issue? Is this maybe a uterine factor where there's fibroids going on? Is it a male factor issue where there might be sperm abnormalities? Or is it really what we call unexplained infertility, right? That's the diagnosis that people come up with too. Doesn't mean that there's not a problem. It means our tests are not good enough to be able to tell you what that problem is because it's 2020 we have, a fair amount of scientific knowledge, but there's still things beyond which that we can't diagnose just by looking at a lab value or looking at a sperm analysis. It's oftentimes what's happening with that egg and sperm once they meet. Are they fertilizing? Are they continuing to grow and divide? Are they implanting? Do they have the right genetics, right? There's a lot of unknowns still. It's still somewhat of a black box. Even for couples with unexplained infertility, there are very well-defined treatment plans of what we do for couples that have unexplained infertility. Sometimes, many times we have same-sex couples and we know kind of exactly where the issue may be, and it's an access to sperm issue, right? And that makes things, fairly straightforward, but we still will go through the rest of the process, right? We'll still evaluate the ovaries and still evaluate the tubes in the uterus because we want to make sure that when we are trying for pregnancy that we've got all our ducks in a row and we're really optimizing those chances for pregnancy. So your first fertility evaluation is really trying to understand you and understand what your body's telling us so that way we can get you on the right path.
Well, we thank all of you for joining us this evening, and we appreciate your questions and really for wanting to take that first step and getting some more information about that first new patient appointment. We hope that you have found that this information is valuable. If fertility treatment is something that you're considering, please feel free to schedule a virtual or in-person appointment with us on our website, or you're welcome to call the office as well. And again, we'll be hosting another webinar in 2 weeks, and we hope to see you there. We'll include a link to register for that one in the email tomorrow.
All right. Thanks so much, guys. Have a pleasant evening. Stay safe, and we'll hope to see you soon.
Bye, everyone.
Bye-bye.